Hey guys, let's have a candid conversation about alternatives to RTM. So RTM is remote therapeutic monitoring. It's an amazing opportunity. I'm so happy that physical therapists are able to provide this service. I think it's awesome. But that being said, I do not offer RTM. It doesn't really align for my treatment style. It doesn't align for my clinic and my business operation. And I think that there are better opportunities to deliver a similar level of service for higher reimbursement with more flexibility and less stress or workload on the therapist. So if you're doing RTM successfully, that's awesome. Keep doing it. Don't change a single thing. But if you're looking for another opportunity, let's talk about the power of what I refer to as a single unit session. Single unit session is exactly what it sounds like. I do 15 minutes. It could be as low as 8. It could be as high as 22. But I do a single unit session. I focus on a specific either intervention or I focus on a specific functional deficit, and I review, I educate, I inform, I do all the things that I love to do as a therapist. So what does something like this look like? How does something like this work in actual application? Many of you are mobile therapists. I can talk about this on a brick and mortar basis also, but let's stick with mobile therapy for this video. If I was a mobile therapist, I would go to the patient's home on the first session. I'd deliver an amazing evaluation. I'd deliver my billable treatment units. But before I finished that first session, I would ensure that the patient has the opportunity to push a button and connect with me tomorrow, the next day, the day after, through a telehealth HIPAA-compliant platform. Now, just about every EMR is offering some sort of telehealth that is HIPAA compliant. But if you're not on an EMR, if you're still using other forms of documentation, you can register for free accounts. There are multiple platforms out there that will sign a BAA, that will provide you concurrent video and audio to comply with Medicare guidelines. And remember, Medicare will continue to pay for telehealth delivered by a physical therapist or occupational therapist in private practice until the end of 2024. Right now, it's September 2023, so we have a long runway ahead of us to utilize this service and help improve patient outcomes along the way. But basically what I would do is I would make sure the patient is ready for push button access, whether I do it on their device or I bring a device with me because I know this is going to be something that I'm going to incorporate into my business model. And so I finish my first time session with the client. I let the client know sometime tomorrow I'm going to reach out to you and I want to review maybe the home exercise program that I showed you today. And so tomorrow rolls around and maybe I have some time in the morning, may have a 15-minute block, maybe a patient cancels or reschedules, maybe I'm getting ready to eat an early lunch and I just want to do this. So I reach out to the patient I saw yesterday. The patient connects. I review whatever the educational material I shared with them yesterday because we know we can deliver the best education in the world, but if patients don't have that repetition, if we don't have an opportunity to connect and ask them if there are questions they have because they're going to forget certain elements about it, they're not going to get the full benefit of it. So maybe yesterday during the evaluation, one of the things that we were working on was weight shifting at the kitchen counter to improve loading through a new total hip replacement. Tomorrow or today, I would connect. I'd say, hey, John, how are you doing? I want to review those exercises I showed you yesterday. First, let me ask you, did you have any increase in symptoms? How did you respond to yesterday's treatment? Everything was great. Okay, awesome. Do you have any questions? No. Okay. I'm going to ask you to prop up the phone so that I can see you. Let's head into the kitchen. Remember, I'm doing this telehealth. Let's head into the kitchen where you can grab onto the kitchen counter and let me see you do the 3 variations of the weight shifting we did yesterday. Surgical leg forward, surgical leg back, lateral or side to side. And so as we're doing this, I'm answering questions, I'm providing cueing, I'm getting a sense to see, do they remember it? Are they safe doing it? Are there any other issues that might have arisen after my first session? As long as I deliver the service and I do it in a compliant manner based on Medicare guidelines or whoever the third-party payer is, that's a billable unit. The unit can be anywhere as low as 8 minutes, as high as 22 minutes, and I can deliver that not just to benefit the patient, but I can deliver it in a way that fits into my schedule. I don't have to drive anywhere. I don't have to commute. I don't have to battle traffic. The patient can be at home, comfortable. Maybe I try to initiate the connection and the patient's busy. They're in the bathroom. No big deal. I try again later. It doesn't affect me in any negative way. There's no significant impact on my schedule. But what it does do for me is it allows me to improve my patient compliance. It allows me to review and improve my patient's understanding of what it is that I'm trying to help them with. And it delivers a billable unit that is not reduced by MPPR, the multiple procedure payment reduction. So now all of a sudden I can start to access open time on my schedule in a convenient way that improves patient outcomes. It's the best of all worlds. And outside of needing a HIPAA compliant telehealth platform, which you can get them for free, I don't have the commitment that I have with remote therapeutic monitoring. You know, in my practice, I do distribute home exercise programs, but they're very simple. One exercise, maybe two. I don't want to be in a position where I'm trying to monitor that stuff. I don't want to comply with the guidelines required for RTM. I'm not against it. It doesn't fit well into my model. So these single unit sessions allow me to optimize my schedule, access time that would have gone unbilled. And I really believe it improves the patient experience. It improves the patient outcome. It starts to build this relationship so that if I see the person in their house on Monday, then on Tuesday, Wednesday, Thursday, Friday, I can see them virtually through the telehealth platform. It gives me access to the patient at times that I would never normally be able to see them in real life. You know, I know occupational therapists who love to be able to do this during the early morning hours when the patient's first getting out of bed. I know physical therapists who love to be able to do this at times where the patient says, well, I'm super stiff in the morning, I loosen up, I feel great, late morning, early day, but then by 5 p.m. I'm just miserable and I need some help. So now the therapist can access that patient, work with that patient virtually at the time the patient needs the services the most without having to fight rush hour traffic, without having to miss picking up your kids from school or being around to coach a sporting event. You know, it just opens up so many opportunities. So if you have questions about it, absolutely let me know. I think that this is a model that is underutilized. There are several therapists that are doing it. They love it. The patients love it. But, you know, if it doesn't work for you, I would love to hear why. I would love to know what you think and what your thoughts are on the topic.